I now call to order this meeting of the Senate Health and Human Services Committee. David, will you please call the roll?
Capoletti.
Here.
Collette.
Here.
Culver.
Here.
Ferry.
Here.
Haywood.
Here.
Hutchinson.
Here.
Schwenk.
Here.
Stefano.
Here.
Ward Judy.
Here.
Ward Kim.
Proxy.
And Brooks.
Here. We have a quorum. The first bill on today's agenda is House Bill 2344, sponsored by Representative Borowski. Is there a motion to consider the bill? Moved by Senator Haywood, seconded by myself. I understand that Representative Borowski is here. Would you like to say a few words on your legislation? And Senator Kearney, would you also like to join her?
Good afternoon. Thank you very much, Senator Brooks, for bringing this 2344 for consideration, and thank you to the committee. This legislation, working closely with Senator Carney's office, we have introduced and are looking to help make changes within our system when it comes to hospital closures and consolidations. Specifically, this is something that has impacted Delaware County, where I am a representative. And not only have we seen the loss of very important healthcare access for many communities, but we've also seen the loss of many jobs in our community as well when it comes to healthcare. So the hope is that this legislation will provide some more tools for the Attorney General's office to use when they are considering these closures and consolidations, and to make sure that we are not only considering our hospitals, but also making sure that we are considering patient care and that the communities that are being served. And I defer to Senator Carney.
Thank you. I want to thank the chair for bringing this forward and for all her work and her staff's work on this bill over the last year. It's something that is very important to healthcare, not just in Delaware County, but across the state. There is an amendment, I know, which we've just recently seen. We still want this bill to move forward going through. We think that there might be some things hopefully we can tweak a little bit as we go through the process. But again, I wanted to extend my thanks, and it's a bill I wish we didn't have to do, but I think we really do need to do from the state of healthcare we see across the Commonwealth. And again, this is not a Delaware County problem. We know it's a problem all across the Commonwealth. So thank you.
Thank you very much. I offer amendment number A05867 and move for its adoption. Do I hear a second? Seconded by Senator Ferry. This amendment makes several changes to the bill, including limiting the definition of acquired entities to healthcare facilities and exempting smaller physician or psychiatric practices. It modifies the financial threshold to $10 million for individual transactions or $35 million in aggregate annual acquisitions. It shortens the review period to 45 days and also makes the Attorney General's authority to hold public hearings discretionary. Finally, it includes a 4-year sunset clause and mandates a study by the Healthcare Cost Containment Council on the effects of the act within 3 years of its effective date. A great deal of discussions were had regarding this legislation, and I'd like to personally thank the Attorney General's office for making themselves available to us to get to this point. I'd also like to thank Senator Carney and his staff for their dedication on this issue. This is something we've spent a lot of time working on with stakeholders from all sides, and I feel this amendment brings us closer to the middle ground as we can get to this late in the session. Are there any questions or comments on the amendment? Senator Ward.
It's actually on the bill.
On the bill. On the amendment, David, will you please call the roll?
Capoletti.
Aye.
Collette.
Aye.
Culver.
Aye.
Ferry.
Aye.
Haywood.
Aye.
Hutchinson.
Aye.
Schwenk.
Aye.
Stefano.
Aye.
Ward Judy.
Aye.
Ward Kim,
Proxy, aye.
and Brooks.
Aye. The amendment having been adopted, are there any comments on the bill as amended? Senator Ward?
Thank you, Senator Brooks. I agree with Senator Carney. Some things need done here. We have to do something to help our hospital system in Pennsylvania. But obviously, I know there's been a lot of negotiations, but not all stakeholders are on board with, even with the amendment. So I would like to offer that maybe there could be additional discussion to get people a little bit closer, as you said, tweak things a bit and get people closer to being comfortable with this. Thank you.
Thank you, Senator Ward. Senator Culver?
Thank you, Madam Chairwoman. Having had 2 hospitals close while in office, I know the impact to access to care and the impact to residents staying healthy and getting that care. And I've heard from multiple constituents in support of this bill today, hoping that it would stop this from happening again in our rural area, and had hoped that maybe it would have helped previously. But I recognize the need to have these systems in place to protect against such loss of services to our Commonwealth. So I want to commend everyone involved in this for their work. This is not easy. This is complicated that you've done this legislation to this point. I am in full support of this bill, advancing out of committee. I know there are concerns, I think, as we've all heard from certain stakeholders that, they're just not quite there yet on the bill, but I look forward for us having further conversations on the bill. I encourage all stakeholders to come forward now and have those conversations with the makers of the bill, with the chair, with the committee as we move forward. And I thank you, Madam Chair, for the amendment and all the work you've done so far on this bill. And thank you for your time.
Thank you very much. Senator Haywood?
I would really just like to second all that Senator Culver said. And that's it.
I'd like to thank the members. There have been significant conversations with the stakeholders, and I do hope those conversations will continue. The legislation has changed dramatically since being voted on in the House. To try and get to that middle ground and build consensus. But as the members have said, there are so many communities that have been challenged with their hospitals closing or being downsized. It leaves care where folks have to drive 45 minutes to an hour to go to a hospital. And I'm hoping, and I think we all are hoping, that this legislation will help healthcare in Pennsylvania so that when purchases are made, if promises are made, those promises are fulfilled, and that the folks that are buying these hospitals meet the obligations and the mission of those hospitals. And that is the true intent of this legislation. It doesn't matter where you live in Pennsylvania, whether it's urban, suburban, or rural. It's not just about having access to some health care, it's having access to quality health care. And that means doctors in our communities. It means the entire spectrum of professionals in healthcare in our communities. So with that, seeing no further questions or comments, David, would you please call the roll on the bill as amended?
Capoletti.
Aye.
Collette.
Aye.
Culver.
Aye.
Ferry.
Aye.
Haywood.
Aye.
Hutchinson.
Aye.
Schwenk.
Aye.
Stefano.
Aye.
Ward Judy.
Aye.
Ward Kim,
Proxy, aye?
and Brooks.
Aye. House Bill 2344, as amended, passes unanimously and is reported out of committee.